I think we have still folks are still joining, but we can go ahead and begin.
Let's start.
So welcome everyone to the SADS Foundation's School Nurse webinar in conjunction with Project Adam about the recent sudden cardiac arrest. I'm Marcia Baker, I'm the program director for the SADS Foundation. And we at the SADS Foundation had an overwhelming response. We had about 2,400 school nurses register for this event tonight. So with so many nurses, we actually had to upgrade our platform to Zoom webinar. So that's why you're all joining with a new link. The webinar is being recorded and the link will be sent tomorrow morning to all who have registered. So you can watch it again. Anyway, a couple of reminders. So you're all muted, your sound is muted for everyone. You can raise your hand and we can unmute you to verbally ask a question or make a comment. Please post your questions for the panelists and hosts in the Q&A box that's on the bottom of your screen. We can respond to as many of those questions as possible after the two presentations. So again, if you'd like to verbally ask a question, just please raise your hand at the bottom of the screen and we'll unmute you. So now it's my pleasure to introduce our presenters. We have Alice Lara, the Chief Executive Officer of the SADS Foundation. Alice is a former nurse and nurse educator and now has been with the SADS Foundation as our CEO for the past 22 years. And joining us and collaborating with us is Allie Thompson. Allie serves as the Project Adam Administrator in Wisconsin and oversees the national affiliate program of a growing 38 affiliate programs in 29 states across the US. She graduated from the University of Wisconsin-La Crosse with a Bachelor of Science in Community Health Education, and later went back for her Master's of Business Administration with a healthcare emphasis. Allie possesses over 15 years of public and community health education program development and implementation experience in schools and communities, statewide and nationally. So we're honored to have both Alice and Allie volunteering their expertise and time with us tonight and share some valuable resources for you if you are faced with a cardiac emergency situation. And I want to remind you that watch your email inbox for a brief school nurse survey that we've just sent to you. It only takes about 5 minutes to complete and it will help us to help you. So you can watch for future details about local forums as a follow-up and next steps following our presentation. So now I'd like to turn it over to Alice as our CEO and get us started.
Great, thanks, Marcia. And we are so excited, like Allie said, to be able to have you all join us. And we had so many people register that it was amazing in this short period, but we just felt like it was really important to make sure that we had your voice and your experience and expertise in the schools at this critical time, because I'm sure you're all getting a lot of questions and a lot of comments and concern like we are. And so we just wanted to make sure that we were all on the same page and that you were, totally thinking that this was a great time for us to really make sure that, we can do this great work. We're so pleased that Tamar is out of the hospital and going home, and it's just an amazing outcome. And we really want to commend the team on the field that was perfect and did exactly what they were supposed to. And that is just such a huge way for us to be able to see, and for the world, basically, all the people. I mean, I don't really watch football, but I definitely got a lot of texts of people that were, and I joined right away and saw it. So I think it's just to be able to show everyone, this is the way you do it. This is the way everyone can do it. You can learn to save a life and you can have these great outcomes. And it's not hard, and it can happen to anyone, anywhere. So it was totally unexpected for sure in this elite athlete. So I think that was really our main point. And Erin, do you want to go ahead? We have a short clip from our board chair, Dr. Michael Ackerman from the Mayo Clinic. And we just pulled that off of a program we call SADS Live that we do twice a month. that we broadcast live on Facebook and YouTube and Twitter. And so this was just like his takeaway summary after all this happened. So thanks, Aaron.
Mr. DeMar Hamlin is recovering, as you and I have heard from the press releases and from the press conferences. Neurologic recovery, the noggin looks good, breathing tube apparently removed, asked right away, did we win? So there's, we can breathe a sigh of relief for him of that it looks like we're going to have a good story, a heroic story of recovery. Why? In part, the why is athletic trainer Denny Kellington, who he and the team, when they noticed something was amiss, that this wasn't just somebody falling to the ground, but things weren't right, activated the chain of survival promptly and effectively, calling, pushing, shocking, meaning 911, push, effective CPR, deep and fast, and until first responders and order was restored. Seen a lot of wonderful things happen after the fact, awareness increasing, and getting the focus put on the right perspective of rapid response saves lives. CPR saves lives, which has been something that we at SADS Foundation have been saying for years and have been helping schools get equipped, making sure that schools are safe, working with the school nurses, working with communities. Is it not just a SAD safe school, but is it a SAD safe community?
Uh-oh.
Sorry, Alice, I think that was the wrong video. So let me try to get the other one up.
That was the wrong one? Oh, okay. Fine, I didn't know.
I'm not sure if you want to start with it. I can show the video afterwards.
Sure, yeah, we can absolutely do that. And I think we can also send you the clip afterwards as well, because it was a little bit low, that one. So we can send that out. So let me see if I can do my share screen with the slides for mine, and then hopefully get into slideshow mode. Okay, can you see my screen?
Looks good, Alice.
I mean, it's not going to me, but I can do that because it's, anyways. So thanks again for coming. And like we said, we really, really appreciate that you're wanting to hear from us. And I think I want to share a little bit about the SADS Foundation and our role in working with families who have or risk for sudden cardiac arrest and sudden cardiac death with their kids and other family members. And I think our big pieces in this are warning signs for people that aren't diagnosed, that don't know they might have something. And so these are our 3 warning signs: fainting or seizure during exercise, excitement, or startle. And so that would be potentially something that you would want to get checked out, as well as unusual chest pain or shortness of breath during exercise. And the number 1 warning sign is a family history of unexplained sudden death of a young person under 40 years old. Those are the 3 top warning signs. And we know that a lot of young people who die suddenly with a sudden cardiac arrest have had some kind of a warning sign that wasn't recognized. So that's where we want to make sure that that is recognized and is able to be diagnosed and treated. A couple of quick slides that I'm not really going to go through, but they are from a search of literature that we did for another webinar to really show some of the risk that is out there. Like, we do not focus on athletes. This is really a big focus on an athlete because of the event. But you know, for our kids, it's not just athletes. And as you can see here, that there really is no incidence even in competitive sports and non-competitive or recreational activities. And the incidence in just the general population is 6 times higher than an athlete. So the athletes are the ones in the news and the ones that get the attention, but it's not just athletes that might be at risk. And that's why we say it's really important to know what to do, to know CPR, you know, to know where the AED is, and to do something to get started with CPR. This slide again is pointing out that there's varying risks of what, how old you might be, and if you're male or female, but also other things you're doing, which is not just athletes. Sleeping and being at home, watching TV, etc. There's just, those are the top sudden cardiac death occurrences in terms of young people. And then the warning signs, this is just to illustrate that there are a lot of warning signs. People that have had warning signs, 74% had at least one cardiac symptom before they had their sudden cardiac arrest. 34% had syncope. So it just illustrates that fact that there are warning signs, and if they would have been able to, you know, get that checked out, that might have prevented their sudden cardiac death. So our take home for this piece of it is, remember that, you know, the incidence in young people for sudden cardiac arrest and sudden cardiac death is thankfully very low, but it does exist, and obviously is really a tragic thing, because they do have, you know, a lot of life left and a lot of things they might be doing. So we just want not to, you know, scare everyone in the school community, but just to say you have a role to play, that you can really help us prevent these. Again, it's all young people, not just athletes, and it's not just during exercise or sports, but it can happen during rest or even doing other things, almost any other thing. We've had a sudden cardiac arrest in a person with a SADS condition. And then we do, this is a picture from our website, but we do have a lot of resources, as does Project Adam, to help you all. And we are here to help you all. So this is one that we participate, it's a coalition for Call Push Shock. And so a number of nonprofits like us and Project Adam and Parent Heart Watch are really trying to put this out there. And I think this is a huge time to do that, that if people knew those 3 things, and it got to be a very common thing. What do you do if something happens? Call 911, push as hard and fast as you can on the victim's chest until someone comes to take over, and get someone to bring the AED, hopefully that you have, like they did have for Damar, because that never is a problem. So what we want you to know, and I think Dr. Ackerman, if we get that piece up, would say, is there is no downside to calling 911, to starting CPR, and to putting pads on the chest that would show you what is their rhythm, because it will not shock if it isn't a shockable rhythm. So this is absolutely 100% what should be done, and we could save these lives if we did, and you know, if we had everybody trained to do that. Our recommendations for our kids, and by our kids, I mean kids that have been diagnosed with a SADS condition, as well as, and the top piece is for everyone, there is a risk assessment form that you can get on our website. I know other organizations also have these, they're similar, and as well as a lot of the medical organizations, pediatricians, etc., have approved these to be used. So we say every child should have this risk assessment, take it either with the parent helping and then taking it to the doctor, or you take it with the doctor, or, you know, you guys know that, you know, and can administer that, or can give it to the parent, because it's just a simple checklist. that if you have a child in your school that has been diagnosed with a SADS condition, we have care plans that you would recognize that are based on the care plans that NASN has. And if we don't have a care plan for that particular child, we can make one. Right now we have the SADS conditions as well as just a strict, I have an ICD, that we have a care plan. And so basically that's a plan that outlines, you know, what is it, activity restrictions that the physician may have, any medications, all those kind of general things. And then what we recommend that the school needs to protect that child who has been diagnosed. And then we also really, really strongly, all of us in this space are really pushing to have all kids trained in CPR with an AED. And we put this as high school kids before they graduate, but certainly we have done training on kids of all ages that are in school, and even little kids can learn to call 911. I'm sure, you know, you all know that and have done that, but it's not a difficult thing. And we have had kids who have saved people, even their coaches, because they have been trained in school on CPR. So that's really important. And then the cardiac emergency plan, response plan, and a number of other school issues or documents. We recommend that the school have this, that you be a heart safe school. And Allie will be able to talk more about that because that's really Project Adam's expertise, and they have all the information and help you could want if you need help to get your school heart safe. And then our warning signs, as we mentioned before, that everyone should know that and should be aware that that's something to do. I thought this was already gone, sorry. So that's the basics, and I know there'll be a lot of questions, but we just want everyone to be able to say, you know, we give out information to our parents. We have a checklist for them to talk to you, to talk to other school people, but you as the healthcare expert in the school can really be helpful in this and can really help educating teachers, coaches, etc. In what needs to happen if you do have a child in school. And for the most part, there's not a lot that, you know, is different. I mean, that they can't nowadays, they can participate in most sports, most other activities, but it's just the awareness piece, the part that, you know, they have this, teachers know they have a condition, and that they know to be aware of little things like, oh, this child just fell away out on the playground. Maybe I should run out and see if they're okay, as opposed to waiting until they stand up, that kind of thing. So it's not really that much different for a child with a SADS condition, but it is important, and we are here to help in whatever way that you all need. If you have questions, if you have somebody diagnosed, we have speakers, we have et cetera, et cetera. And then we will talk about at the end of this show, but we are planning with Project Adam to do some more local seminars where it will be smaller meetings. I mean, this was, we changed it out at the last minute, which is why it's sort of a scramble, because there were so many of you that wanted to join and talk about or hear about this. But I think we want to do some, you know, really smaller meetings where we can communicate and have questions in your local area with Project Adam affiliates. So Allie can talk a little bit more about that. Now I need to learn, stop sharing. Thank you very much.
Thank you, Alice. And now we'll hear from Project Adam. Hi, Allie. There you go. You're good.
Great. Good evening. I first and foremost want to thank Alice, Marcia, Aaron, Genevieve, the SADS Foundation leadership, the SADS Foundation team and group across the country. Thank you so much for inviting and partnering with us. We're really, really excited to be here. So I want to talk a little bit about how do we prepare for a cardiac emergency? And let me just get my slides going here. All right, I think I'm good. We, myself included in our team, we could talk for hours on this topic. So to kind of piece everything together into 15 minutes, it's going to be kind of a crash course, but hoping between SADS, between Project Adam, that you leave with a couple key action steps that you can take in your school or community today, tomorrow, and then build upon that. So I first want to share Adam's story, and I think we're all among friends and community here, and can all come together on this topic, and also have experienced either loss, a save, and I think almost everybody probably that is on this webinar has a personal story. So tonight I'm going to share Adam's. So in 1999, he was 17 while he was playing basketball when he collapsed. CPR was initiated and 911 was called. No AED was available in the school. And, I think it's safe to say at that point in time, there wasn't AEDs, period, in schools, let alone in the community. So there was not a chance there. EMS arrived, and they happened to be right across the street from the school. So that shows you how close they were. And yet Adam passed away because there was not a trained team. There was not bystanders. There was not the evidence that we have today and the steps that we know are proven and work. From that was born Project Adam in the early 2000s, and it's quickly spread to be a program that has spread across the country, where we have medical directors and program coordinators working together in their local communities to help build heart-safe schools, heart-safe environments. Our mission is to empower communities and schools to be prepared for sudden cardiac arrest. So everything we talk about today that can be built in a school can also be adapted to a community site, a youth sports program. So a lot of these key action steps can be replicated in other environments. Here's a look at our incredible team. I think too, between SADS and Project Adam, you have so many great experts, advocates, resources to connect with. And that's really one of the big steps we're accomplishing tonight is connecting us all. So just a wonderful team. Quickly calling out, sudden cardiac arrest, sudden cardiac death. We know some of these causes. We know a lot of them are genetic, and the wonderful resources SADS is providing and continues to provide. We know some of the other causes, and we also know that any of these causes, secondary prevention and calling 911, starting CPR, and getting the AED are relevant. So I think we talked about some of the different things that can cause sudden cardiac death. All of these require the same action steps, and all of us require the same care as we saw last Monday evening. So I will call out some words of a colleague of mine, Gwen Foss, who many of you know. What we're doing is for all hearts, which Alice spoke to as well. So a bit about recognition, and we saw this play out live on Monday. Unresponsive, not breathing, seizure-like activity may be present. Action was taken right away. So we saw a beautiful outcome. So otherwise, if we do nothing, I think we know what will happen. Unresponsive, pulseless, and we don't take action. We only have those crucial minutes to start CPR, get the AED applied, and analyze the rhythm. So again, calling out, what we're going to focus on, the secondary prevention piece, recognizing sudden cardiac arrest, having a plan, training, and then also alluding to that call, push, shock, which is a very simplistic message that can be used in your schools and communities. So here's the crash course on preparing your school for a cardiac emergency. Where do I start? There's lots of steps, but if we kind of break it down into some key areas, there's definitely some action steps you can take. So starting out, I want to point out, and we can send all these resources in the follow-up and in the chat, but our Heart Safe School checklist is here to help you. It's broken down and easy to follow. It's the main categories are AEDs, developing a response team, a response plan, and then looking into training staff and educating staff on CPR and AED skills and sudden cardiac arrest recognition. And then the last piece, pulling everything together, is running an AED drill to really practice out that response that we saw, again, alluding to Monday night, trained professionals. And we, saw the picture of the team members getting recognized, the athletic training team, and just how chilling that was. And just that they practice, their whole professional lives for this. They were prepared for this. When we're working in our schools and communities, our schools, our educators, they have so many different roles. And being prepared for a cardiac emergency, we're asking them to do one more thing. But that AED drill is going to bring that confidence and that comfort to make sure that they feel confident to practice out starting CPR, getting the AED. So the Heart Safe School checklist, will make sure you have that link, but the first section that we're going to talk about are AEDs. And I already saw in the chat, how many AEDs should we have in our school? How many AEDs should we have on our campus? The goal is that anywhere within anywhere in a building, upon a collapse, round trip, you should be able to retrieve the AED, get it back to the victim, and apply the pads in under 3 minutes. So for some schools, that may mean one AED. For larger campuses, yeah, that's definitely going to be multiple. And the best way to do that is to, schedule some time and do a walkthrough. And if you already have some AEDs, maybe you're looking into getting a couple additional ones. A few things to consider when you're thinking about AED placement on your campus. You want to think about, are we covering more buildings? Do we need to think about that? Is the community using the AEDs, and do we need to consider, and we'll talk about that later when we discuss developing a plan. Do we have athletic fields that we need to cover and make sure that there's access, at least if there is not a placed AED, but is there one that's carried by an athletic trainer or a traveling unit that can get there, practice fields. And then talking, more about, that's more the plan piece, but sending AEDs with teams at various fields as well. But what we want to focus on tonight is that goal in under 3 minutes, that we want to be able to get to the AED and apply the pads, and really thinking of it, starting with the school building and then expanding out from there as you kind of get things squared away within the school. A little bit about the team. So this is the next section of really thinking about putting together a full CPR and AED program, a full Heart Safe School. So it can seem overwhelming to create a whole separate team for a cardiac emergency. So the first thing we want you to ask and think about, do we already have a medical emergency response teams that's set up, that may already have some training in first aid and maybe CPR and AED skills? You do not have to have a separate team for this initiative. You can just add upon that. And the key being making sure the AED is coming to every medical emergency and sudden collapse, and that AED drills are run to practice that response. We're looking for 10% of staff involved. That's the kind of the best practice number out there, that we really want those individuals to get CPR AED training or certification. And then we want them to be comfortable in running an AED drill. And those are the individuals that are going to respond to the scene upon a sudden collapse. When we're talking about the plan, this is another section of building your program. So do we have a plan? And a plan is, on paper, it sounds like, okay, we call 911, we start CPR, and we get the AED, and we got that. That's under control. But there's clearly more things to think about within an environment, more things to consider. So what we recommend is that you develop a policy, almost like a written fuller policy that we call a cardiac emergency response plan that Alice alluded to. And there's tons of templates out there. We have one on our website that was created with multiple organizations, including the American Heart Association. And it's anything and everything that you would ever want to consider best practice wise for a school CPR AED program. From there, you can whittle it down for what makes sense for your school, for your district. So anything that you find, especially on our website, is customizable, and you can go on, download a Word document, and then make it what needs to be for your building. Do not recreate the wheel. There are resources out there. And then that number 2 piece of the plan is, what do the team members do if a code is called? So if a member is on the emergency response team, they obviously know that they're on the team, but is there a code that's developed and disseminated across the school? Does everybody know what that code is? Who is calling 911? Are we calling 911 from the scene with a cell phone? Are we coordinating that eventually the front office would call 911? So a lot of details in that abbreviated plan that staff can hold, that is very simplistic. This is what we do in a cardiac emergency. I may play a different role each and every time, and that's where the AED drills come in, is you get to practice and feel confident within those different roles. But what are the key roles and action steps? And again, we have templates on the website for that. Jumping to the 4th section that we'll talk about, kind of 4th and 5th combined. What types of training and education do we have to have? And a lot of times it's, what is this going to cost, and how much time and energy is it going to cost our staff and people that are going to help out on the team? The first thing is obtaining CPR and AED training for that 10%. If at all possible, all staff, all students should be trained, if possible, in hands-only CPR and AED, if at all possible. But when we're talking about CPR and AED training, it can take anywhere from 5 to 30 minutes. There's tons of videos out there that walk through recognizing sudden cardiac arrest, calling 911, starting hands-only CPR, and how to use an AED. So training is, very cost effective, very time effective, and can be a great solution. We never want to hold somebody back from implementing a full CPR AED program, a Heart Safe School. So if training is the only thing that at this point your school can support, afford, start there. Don't wait until you have this, the perfect budget to do certification. Do something and build upon it. CPR and AED certification is another form of CPR and AED training for staff. And I think we all know that there's a cost to that, and that can vary by company. And there's lots of different resources out there for certification. It's a little more time intensive as well. So kind of deciding between the two. When we talk about all staff training on sudden cardiac arrest, that is really recognizing the signs of a cardiac arrest, that seizure-like activity that we talk about. And then where are the AEDs located? Who's the team, so they're familiar and know, who is helping to respond to these emergencies and is trained and comfortable. These types of trainings really are no cost and can be done at a staff, all staff meeting, pre the school year, during the school year, and definitely outlines and information for that. Then we get to the AED drill, and that's really putting everything together. A drill is really putting a mannequin down anywhere on the campus. It is calling that code, whether it's overhead, from the office, whether it's a page. There's different ways that schools communicate. But that's putting down that mannequin, calling the team, and really seeing what unfolds. It's very nice to have a, we can talk more about this in the regional meetings, but a site coordinator or leader, and that's usually you as the school nurse, as we have so many school nurses on, that's usually you helping to facilitate, but taking a step back and taking a deep breath and saying, if I'm not in the building, this team is practicing what needs to be done, and they know and they feel confident. So the AED drill, letting everything unfold, having people respond, getting the real AED from the school, not actually using those pads, but then bringing an AED training unit, applying that unit, and then, waiting for EMS to get there too. So kind of seeing what happens, debriefing and taking some notes, and then afterwards having a discussion about what can we do better. Maybe that was our first time doing a practice drill. When should we do another one to build upon that response? And then the main goal of all of this is, making sure that this is done on an annual basis. So some of this work can take a little bit of work on the front end. So if I do one thing tomorrow, if I take the checklist and kind of see what we have in place, that's one step. If then I try to get our staff, try to seek out training, CPR and AED training, if we're not doing that, that's another step. Getting that drill in place, that's kind of usually the last step. Once all those things are in place and part of practice, it runs on its own annually, and there's a system in place. So it's not time intensive. So, talking about some of the things that are done on an annual basis. So a lot of times when we're having discussions, we start with, and I need to kind of hurry up because I think I'm running out of time. We usually lead with, what is the need for a program? What is the evidence? The really fun part about this program is, or this webinar tonight, is we don't need to do that, because I think everyone here knows the need. And I think we all want to do something, and that's why we're here. A little bit of evidence for you to take back. The focus on schools is that 20% is, within our schools on any given day. And we know that athletics run through them, community events run through them. There's so much of our community that happens in our schools. It's a great launching pad to get a program in place and then build around throughout your community, building heart-safe environments. This policy statement is what our checklist is really built around too, and published in the School Nurse Journal, but really supporting, having a plan, having a team, running drills. This is John Dresner's study. Many of you have either heard about him, heard about his resources, just a phenomenal advocate for CPR and AED preparedness in our field. But taking a look at some of his studies, and we can provide this information to you, that, programs that, or schools that have a plan in place had a higher survival rate when this study was done. So, we have the evidence, it's just about getting it in place. So next steps, don't wait. I know there was probably a lot of resources thrown out there today, but start working with your school administration and staff to assess and make a plan. Utilize our resources, utilize SAD's resources. Parent Heart Watch has wonderful resources. We want to come together and bring you those resources, and that's why we're collaborating. Contact our Project Adam team for further support. We have experts across the country, and so we want to make those connections for you so that they can help you through this process and you don't have to do it alone. So I included a couple links in our Facebook and Instagram at Support Project Adam. And then just a thank you for all you do. And you guys are really true heroes, and it's an honor and a privilege to partner with you all. Thank you.
That's great, Allie. Thanks so much. And I wanted to jump right in because we're running out of time, and I know that there's a lot, but some of the very first questions I think related to the difference between SADS and Project Adam. So we didn't really, I alluded a little bit to that, but I just wanted to do a quick thing on that. For SADS Foundation, we work really closely with groups like Project Adam. And like she mentioned, Parent Heart Watch and SCA Foundation and a bunch of other organizations. But we really focus on people who have a SADS condition, which they are genetic heart conditions. So that means they're inherited. And that most of them, almost all of the ones that we work with are, you have a 50% chance of having a child with a SADS condition if you as a parent have a SADS condition. So they can, these put you then at risk for sudden cardiac arrest, but they can be treated and you live a long and healthy life. So if you know, but normally you're fine and healthy and you don't know until something happens a lot of times. So that's why we were stressing there are warning signs, but you know, that's the thing to know about that. And I think that we focus on making sure that that people with SADS conditions can be diagnosed and treated appropriately and live these great lives. And we work with partners like Project Adam to really help that happen in that secondary prevention, like Ali mentioned, to make the schools safe for our kids as well as everyone else, the janitor and the grandparent and whoever. But that's sort of how we work together. So we have a lot of material, and we do have a great webinar that we did last fall in our SAD Safe Schools month. One of our experts did specifically for school nurses that talk about the conditions and things that you need to know. So we focus on education about that information and work with groups like Project Adam to do the overall sudden cardiac arrest. So I just wanted to clarify that. And I do also want to you know, just echo what Ali said about thank you and for everything that you do. We know that people in this country do not have this successful outcome very often. And only about 1 in 10 people that have a cardiac arrest survive. And that is primarily because people don't start CPR, there is not the AED. So we also know, because of some studies in some particular cities and states that have really, you know, ramped up the program, and Ali, you can jump in, but we know that, you know, we could get a lot better in that survival, and we could really get like half of those 10. Obviously we can't save everyone, sometimes the heart is too damaged, but you know, that's really the big push, is that, you know, this does save lives and you really can save, and kids, and you know, I mean, everyone can be saving that. So I think that was the main piece. And then Ali, I think there was some questions for you in that chat. The only other one, which I think you guys can look at, is just about who do you test if they check on that checklist that they had a parent that died suddenly, or a grandparent, where does that start? And again, because they are genetic, we can totally help you with that, but you usually start with that nuclear family, the people that were closest to that person that died. Obviously, if that happened a long time ago and you're talking about the child, then you can start there and with the child's family, parents and siblings. So, go ahead, Alan.
There were a few questions about AEDs as well, purchasing. You know, I think number one, check locally too, you know, making those connections with your Project Adam affiliate. A lot of times they will have, you know, really good customer service companies that they can refer you to. We also have a couple, you know, companies that we partner with nationally that have really good customer service and pricing. I think the customer service is key, because, you know, to be able to ask some of those questions and have somebody to go to versus just ordering on a website, you know, because that process can be intimidating. But I think, as you all know, the AEDs out there right now are easy to use. You pretty much take them out of the box and they're like ready to put on the wall. So they're just pretty amazing. The back order, I believe there is still, you know, back orders on various units. I would, if you're looking and you need an AED like ASAP, you can always check with the company that you're working with and let them know your timeline. And they may be able to give you a recommendation on, you know, maybe this unit has more, you know, isn't as back ordered. But definitely, you know, Alice and I and others, we can look into that a little bit more and see if there's any more updates from the AED company world. I'm not sure, but I think there are still back orders. But definitely, you know, funding. There's also a platform called gotaed.org, and you can start a campaign. So there's like a, you know, a way to fundraise as well. But lots of resources out there, and we can talk more at regional.
And I think you need to remember that there are, and Ali, I know you're the expert, so I'm speaking out of turn here, but there's a lot of things to do to maintain, checklists that you guys have to maintain your AED. But when you have a situation like supply chain issues that we've been having, you definitely know that pads last longer a lot of times, as long as they're not dried out. And there obviously was a day when there were not pre-moistened pads and you still could use an AED. So I think, it's something to really look at. How is this still functional and how would I use this? And I think the number one thing is that you're aware of that, you're checking that, that that's, an issue, because, that's really important that it could be used for sure. And I think the PD pads is another one where I know some of our parents have had trouble with that. There's no reason that you can't use regular on a young child, even though it's not a PD pad, if you cannot get a PD pad. I mean, again, what is your choice if that child does not get defibrillated at all, or that child gets defibrillated with, an adult shock, basically, I think is, the choice that you're making. I think the other last thing I wanted to say, I'm sure there's a million last things, but I do think that like I said, we provide education and support to parents and families and people with SADS conditions. We did just have a support group last Thursday that was an extra add-on for people, because again, as you can probably imagine, maybe some of you have had that happen, but if you've had a sudden cardiac arrest, or you've had a family member with a sudden cardiac arrest, or even you have a condition that might put you or a family member at risk, seeing that happen, even with that hugely successful outcome, was very traumatic and upsetting. And so we did have one support group last Thursday that went really well. And then our regular support group happens every month. The next one is January 18th at 5:30 p.m. It's free, it's on Zoom. So if you know anyone, or you are someone who wants to process that, then we definitely would recommend, and reach out to us, because it's on our website, but it is a free support group for people, because this has been, people take this differently in different ways. And obviously, if you're a part of this community or you've had an arrest, it is a whole different thing to see that happen.
I was going to ask, we'd like to have Melissa, who's on the line, to share a few things as a parent herself affected with a SADS condition, as well as her two children, and some successful actions that she's taking in her New York community. So Melissa, go ahead, share some of your exciting stories.
Sure. So I'll just take a minute here, so there's more time if anyone has questions. But so I have long QT. I noticed someone in the chat had mentioned having a student with long QT. I have long QT type 2, as do my daughters. They're in 1st and 3rd grade. But as I was thinking about sort of our school practices, thinking to what Alice led off with about the diagnostic, the warning signs to look out for, I think back to my sister, who unfortunately she passed away when she was 24. She had a sudden cardiac arrest and died, and that's how my family was diagnosed. But her first ever symptom that wasn't caught was syncope in high school. The school bell to change classes rang. She was in the cafeteria, collapsed, but she came back. She didn't receive CPR. She came back on her own. But I think with those more school nurses knowing those warning signs, that a faint when it doesn't seem to be anything else really around it to explain it. I think of, what if that nurse had been someone who called my parents and talked to them about it, who did a little bit of research, who just said to my parents, hey, I know this happened in school. Just so you know, why don't you talk to her doctor to make sure that there's not a cardiac concern, just to kind of to plant that seed, right? The school nurse could be that person to plant that seed that really makes a difference. But going to today, much better scenario. My two daughters, when my oldest started kindergarten, the nurse, called me immediately, told me, what her plan was. We worked together. She did, on those days leading up to the start of school, she did some refresher trainings for everyone kind of in the vicinity of my daughter. So she wasn't able to do the entire school. And I know, there's limitations everywhere, right? No one's looking for necessarily a perfect scenario, but she did, kind of refresher. I might be using the wrong terminology. It's not the 4-hour course, but the more, Allie, like you were saying, more the mini training. And so the kindergarten teachers, the aides, the gym teacher, everyone in the area, and they had a plan. We had them write down exactly, to Allie's point, who is going to call 911, who is going to perform CPR, who's going to get that AED. And it's really helped us feel safe. And that's something that we revisit every year, because there's a different classroom team, there's a different grade level team. I'll be honest, it is something that's scary. We've had teachers are scared of this, and I'm sure that's something that the nurse encounters, right? And so I know that our nurse is fabulous. I know that she fields a lot of very, questions from scared teachers. And I think we're all very open and honest in having those conversations where we sit in a room, the teacher, us as the parents, the nurse, and we talk through, okay, hey, we have this condition that does look very scary on paper, but let's talk about it in real terms. And let's say, what is going to happen if the worst thing does happen? How are we going to react? And so now there are 2 AEDs in the building. One's upstairs, one's downstairs. And they just sort of those little things that make a difference. Everyone, when my daughter's out on the playground, everyone's aware. The aides that take them out on the playground, they're aware. And again, that's because my daughters have long QT syndrome. It is an inherited arrhythmia condition. And so the school is on the lookout, I shouldn't say on the lookout. It's not something that hinders their experience. It just means that there's kind of an extra eye on them. And so much of it is just really open collaboration between the parent, the nurse, and the teachers. Because the nurse is the medical expert. The parent, I rely on SADS a lot. I use the templates from SADS, and for the care plan, and bring that to my nurse, and that goes to the teacher. And it's really kind of an all hands on deck thing. And then by the time we're, I'd say, a week or 2 into the school year, everyone kind of feels like, okay, we're into routine now.
Thank you so much, Melissa.
Thank you. Yeah, that was really good. And I did see a number of questions. I know there's some from Allie, but about the webinar that I mentioned. Sorry, I just threw that in, but we'll send that out. It is on our website. It is recorded, and we are always happy to answer questions. If you have any questions specifically about a SADS condition or the difference between a vanilla faint and a concerning faint and those kind of things, we absolutely are happy to answer those questions. But I do think that these are all fabulous questions. So thank you so much for thinking about it. And there are a ton of resources. I mean, we went really fast, and a ton of resources that Allie has for all the drills she mentioned, all the checklists for what you need to do and how to maintain things and all that kind of stuff. As well as we have, like Allie said, we help families to get their own AED if they need those for other purposes. And we work with some companies that can help them and to try and get that insurance company to pay for that. And so there's just a lot of resources that, if you reach out to us. We also, besides those meetings I mentioned that we're going to be having, so please watch your email, because we're going to be having these meetings that will be more in your state and your area with the local Project Adam affiliate. So that they can really be that hands-on person to help even come to your school. We will also be having some other meetings around the country. So we'll definitely have you on the list and if you do want a speaker for one of your regional meetings or a state school nurse, we've done that a lot in the past. So we do have speakers, both medical professionals and family members, which is sometimes is great. And I know Allie and the Project Adam team also does that. So feel free to reach out if there's somebody, if you think that would be a good thing for your next conference.
So I want to thank everyone for joining us tonight. And on behalf of Project Adam and the SADS Foundation, we appreciate you helping us save lives in your schools. So thank you, and watch for our recording and links tomorrow. We'll send out the links to download the presentation as well as review this recording. as
Right,
well. And you
right.
don't have to re-register. We have your contact info. So,
Exactly. But
so
it
thank you
is
so much.
free to register. I mean, we ask people that we do so we know who is watching it. But so if you want to share that, there will be, a simple form online. So anyone that wasn't here can watch this. We'll have that on our YouTube channel. So for sure.
So we appreciate your attention. We're getting lots of thank yous in the chat. So thank you, Allie. Thank you, Alice. Good night, everyone.
Thank you for everyone.